Now let's take a closer look at all mobilization challenges performed together to assist the patient to the restroom. First, the patient is instructed to roll onto her side and sit on the side of the bed unsupported for 5 seconds. If the patient is unable to sit unsupported for 5 seconds, the mobilization task is stopped and reassessed to determine the safest possible transfer. Next, the patient is instructed to stand at the bedside unsupported for approximately 5 seconds. Upon completion of the standing challenge, the patient is instructed to march 5 to 10 steps in place before walking away from the bedside. While the patient marches in place, the caregiver is looking for any signs of ambulation distress. If the patient is not able to tolerate marching in place, the mobilization task is stopped and reassessed. Once all mobilization challenges are completed, the patient and caregiver will walk together into the patient restroom. The patient is instructed to activate the call light when finished, so the caregiver may escort the patient back to bed. Before walking back to bed, the patient will need to stand unsupported for 5 seconds and march 5 to 10 steps in place. If the patient is not able to complete the standing or ambulation challenges, the caregiver will need to default to the safest possible transfer and use a wheelchair or lift device to assist the patient back to bed. If the patient is not able to stand and transfer, the caregiver and patient should perform a sit-to-sit transfer. A removable arm wheelchair is placed next to the patient and commode. The space or gap between the surfaces may need to be bridged using a seated slide board, pillow, or bed linen. Instruct the patient to lean toward the side, away from the direction of the transfer. A single slide sheet is folded in half and tucked under the patient from buttock to thigh. Once tucked, the remaining slide sheet is moved away so the patient may place her hand on the wheelchair. The caregiver stands in front of the patient, supports the wheelchair, and prevents the chair from moving or adjusting. The caregiver may need to assist the patient by lightly pushing on the pelvis or hip. Once the patient is in the wheelchair, the slide sheet is removed. Depending on the patient's level or strength, the sit-to-sit transfer may also be performed without the use of a slide sheet. The principle is simple. If the patient is not able to stand or is not safe to stand, the patient should not be expected to stand. Using the wheelchair, the patient is safely returned to the bedside and the sit-to-sit transfer may be completed again. Just as before, a slide board, pillow, or bed linen may be needed to bridge the gap between surfaces. The patient is instructed to lean away from the direction of the turn. A single slide sheet is folded in half and tucked under the patient's buttocks and thigh. With the caregiver standing in front of the patient and between the two surfaces, the patient is instructed to scoot or slide from the wheelchair into the bed or stretcher. The caregiver may assist by lightly pushing on the patient's hip or pelvis. If at any point the patient was not able to assist with the sit-to-sit transfer, the caregiver should stop and default to the safest possible transfer. In some cases, this may indicate a second caregiver, lift, and sling are needed. Once on the stretcher, the patient is instructed to continue scooting back, to bring lower extremities into the bed, and to return to a supine or sideline position. The caregiver will bring the bed to a comfortable working level, finish positioning the patient, and remove the slide sheet. Remember, we never leave slide sheets under an unattended patient.